Good morning. We are working on law and ethics in counseling. This is the second session for that, and then we will just work on the vital basics of ethical counseling. Well, we have ethics in all areas: political ethics, medical ethics, pastoral ethics, church ethics, Christian ethics, entrepreneurs ethics, corporations ethics. We have all kinds of ethics in this world, and those are very important because we human beings want to be better people. Not all, but some. I don't want to say most. I think I have to say most people want to be ethical, and cause human beings just we want to be reasonable. We want to be reasonable. Reasonable means we want to just follow the common sense and the laws. If we don't see any laws, just follow the common sense. And the society and countries and organizations, they try to keep their societies safe and stable. For that, they want to just provide people what the common senses are, and what the laws are, what the principles are, and those kind of things are very crucial for that kind of, for the societies and managings, and cause without that we can go wrong, and there will be lots of conflicts, because when we have common sense, like just walk right. When I was in my country before I came to the States, the South Korea, we used to walk left. But nowadays they changed their system, so they are walking right. So when I came to the States, I was taking a walk, and some people told me that, actually one told me they walk right, with kind of a frown face or something. That's common sense in the United States, but saying that way is not common sense, because it was kind of rude. So, that was the first person I ever experienced, who told me walk right. So I was thinking, did I walk wrong or awkward? No, that's just walk right on right side. When people, so we don't just bump into each other. That's not common sense, but the way he told me was not common sense, because I understand that there are so many rude people in all places, not only in the United States, but in many other countries in this world. As people, not because of the differences of the culture, but because of their attitudes, their way of, living with other people. But I understand that, because those people are doing that ways, So, just whenever I see crooked people are doing crooked things, it's normal. But the well-educated and good character, hoarders are doing something wrong, and that is awkward. That is awkward. So good people have good manners, and they just treat other people, good ways. It's not surprising. It's not surprising. But those people do something wrong to other people and mistreated others, it is awkward. Or just crooked people and not they don't have common sense in their mind. Cause honestly, we cannot read all the books. I mean, we cannot read all the codes and laws. Have you ever read the United States, US, America's law book? Kind of a thick book. I don't know how thick it is. It must be very thick. I'm not talking about all kinds of codes and things, but the Constitution. Have you ever read that? I didn't. But we have a common sense, even though we haven't read the American Constitution, but we have common sense and we know, little by little in this society. So we have some knowledges and sense of common sense. But the little things, those are little, all big things. Well, because we are familiar with it, we believe that. So it's no wonder that we cannot deny that we haven't educated about the Constitution and those things, so we are free. No. We have sense of, we have common sense. We got those things in this society from, the young, or even though just immigrants, they are getting used to it because they know it. They can see what other people are doing. Though they cannot read English or speaking English, but it's okay because they can learn it. They can learn it and they can feel it from this society, from other people, from the news, from the papers. So, just knowing those things is not, it's good, so we have all common sense, and we have a common sense in counseling, but we have to learn it because it's not common in this society. It is an ethic, specific ethic in a specific area, counseling. So we want to just take a look at the vital basics of ethical counseling. So let's think about it. But those are very basic, so we can get it. We can understand that with our common sense also. Those are pretty vital, so we're gonna take a look at it little by little. Okay, confidentiality is so important because people are coming to their counselors because they want to just say something secret, something personal, something private. Other than that, they don't have to come to their counselors or psychiatrists. A psychiatrist, people are under huge stresses, and they are vulnerable. They have physical problems, or they cannot have the normal daily living. So they feel uncomfortable. They know something is wrong. So they see their psychiatrist. So whether they see psychiatrists or counselors, people are vulnerable. That's why. Other than that, they will not come to those people because they have to pay for it, even though their insurance covers that. Well, they pay time. They spend their time and they have to pay for it. And why they do that? Don't they have best friends? Do they have spouses? I'm pretty sure that even though I have a wife, I have something I don't want to talk to my wife. That is related with my self-esteem. That is kind of humiliating. It is kind of too personal. I don't want to talk to my wife or best friend. You know, some people, people got lured or, you know, got mistreated by strangers. That happens, but people can get mistreated by or betrayed by their best friends. Cause we don't know when people can betray. Okay, we don't know it. We trust others, but they can betray us too. So people want to talk about themselves, but they want to just talk about it, but they cannot find anybody they feel comfortable with. They come to counselors, and they expect some treatments. They expect some medicines. They expect some solutions they can get from counselors or psychiatrists or some other people like the philosophers or they but with my best knowledge and experience, I'm in the 50s, and lots of well-known people like Shakyamuni and Kongfu, and even Bible says that you don't talk to people much. You don't talk any personal or private things to your best friends much. I think that is right. I'm feeling that is right because nobody knows when people betray. Jesus chose 12 people, and one of them betrayed him, Iscariot, Judas. I don't think Iscariot, Judas is a normal person, but he was one of the normal people. He was one of the normal people. But he betrayed Jesus. Peter, he betrayed Jesus also. 3 times he denied Jesus 3 times. In a night, when his rabbi, teacher, Jesus was in trial. Jesus was dragged by people to here and there, but Peter just betrayed Jesus. Deny means he betrayed. I don't know him. He didn't talk 3 times in a night. To whom? To the judge? No. To whom? To the prosecutor? No. To whom? To the lawyer? No. To whom then? To a little girl, maybe. Peter denied Jesus 3 times the night to a little girl. What a shame. So that's what happening to people. So person I know, I just respect the professor, and the professor just told me that if people make sins, that is normal. If they don't make sins but doing good, that is, something good. People get angry when people go wrong and make sins, but that's normal. That's what people do. They tell a lie, they deceive, they cheat. That's normal to people. That's normal. Because that's what people have in their minds, has in their lives. That's normal. So we want to just focus on good things, what people do. And then we can give them goals. Confidentiality, so important. Because we don't have to worry about the betrayal or denial. We pay for it, we spend our time for the counselings. We think that is okay. They are strangers at the first, but counselors know their counselors, and counselors they know their counselors little by little, and they got started from the trust. I pay for it, and you keep the secret. Confidentiality is very important in counseling. Okay? So without any confidentiality, we cannot expect people can come to the counselors. All right? For the confidentiality, we need written consent. I'm gonna just say this and that, and counselor, you wanna keep the secret. Keep the secret, right? I'm gonna just, do these things, and you just keep the secret, alright? And sign on it. Written consent. It's not only for the counselees, that's for the counselors also. So at the written consent, because of it, the counselors are not supposed to tell anything about their counsel leads. So counselors have big responsibilities. Some counselors or psychiatrists, they publish the case book. It's filled with lots of cases and how what they were doing and how they treated those people and what happened at the end. They failed and the counseling was successful. They just say this and that, and we can just learn lots of counseling skills. And we can see, the regular people can see, they can have hope when they meet their counselors. They can get those kind of services, right? Those things are very important. So written consent, confidential, it is very important for the confidentiality. I trust you, you trust me, you don't have to write anything about it. That's nonsense. We need to write something. We need to write. Alright? Duty to report. We have a duty to report. Counselors are not supposed to tell anything about their counselees except some, few things. For example, their counselees are criminals, like killing people and murderers or something like that. Because counselors are not lawyers. Counselors are not lawyers. I don't know what kind of exceptions that they have, the lawyers have, but counselors are not lawyers, and we have to report to something. When we find one of our our counselees mistreated the minors, and we are supposed to report it. When we see counselees, is about to suicide, and we need to report it. Well, at the written consent, we usually record, sign on the paper, counselees are not supposed, they don't want to make a suicide during the counseling sessions and during the counseling periods. And they want to have, feeling that they want to, make a suicide, they are supposed to call or contact their counselors. Those kind of things are very detailed. So the consent form is not just a simple and short, but it is filled with lots of things on it. Lots of things on it. Okay. So those things are what we are supposed to think about, right? Written consent and duty to report. Well, counselees, when they feel they got mistreated by counselors sexually, emotionally, they can report it. They can sue it. I think they can make lots of money from those suits, because counselors are not supposed to mistreat their counselees. That's very important. Okay. So duty to report, especially the counselors. Medicare and Medicaid laws. That means, some people are coming to their counselors, the low-income people. I think most counseling center has sliding scales for the counseling fees to the low-income people, and they afford to their counseling fees, and the counseling centers work with the government, and they get paid from the government, and or non-profit organizations that they are working with, sponsoring, and then so they can just work with it. They can just serve those low-income people, because people are all same. They are low income or high income or highest income. It doesn't matter, whether they have highest social status or not, immigrants or non-immigrants, documented or non-documented. In the past, almost all people were undocumented. Nowadays, documented people are much safer than in the past. Those people in the past, because they were undocumented. Because there were no documents for that. They just came to the States and occupied some lands and just lived there. They didn't even ask who has the right for their lands, but they just lived there or something like that. In the past, that's what happened in the past. The counselors or counseling centers are not supposed to say, "Oh, those counselors have Medicare or medical or something like that." So we cannot say that. Patient as litigant. We want to just protect those people, and whether they are whistleblowers or not, whether they, I think, I just forgot the meaning of the litigant, but litigant, I mean, okay, and yeah. So when they in a low case, I mean in a suit case, and they can be under big pressures, and then counselors they are not supposed to open those people who are in a lawsuit or something like that. You cannot do that. You cannot do that. So confidentiality is very important. Okay. And what about the future criminal behavior? I mean, duty to warn or protect. Counselors can warn people when they are doing something wrong. Their behaviors and their way of thinkings, and they kind of pretty easier for them to make suicide or make scenes and kill people and beat people or something. They can just go wrong, and they can run. I mean, they can warn or they can respect. Okay, those are all confidentiality. And future criminal behavior, when they are planning to kill their parents and children or other people, that's the confidentiality. But there are some exceptions, as I told you. Okay, emergencies. There are lots of emergency situations we have as people. People can come to the counseling centers or private counseling center for the counselings because they have a serious problem and they don't know what to do, and then they have emergency situations. So, so that's the part we need to be careful. And then confidentiality with minors. Okay, the minors, even though they are young, they are minors, but we don't want to just talk about those counselors to their parents or to their guardians. Okay, because even minors, they have a right to talk to their counselors, but they have rights, and they have a trust to their counselors, and counselors are not supposed to talk about them to anybody else, not to their teachers, not to their parents, not to their schools. So group therapy, that's pretty tricky part because, for example, AA, Alcohol Anonymous, they just open their conversation, so they try to learn each other from each other's, and they want to just keep the secrets, but they don't. I mean, they don't want to just share what they learned from the group session, group therapy. So the confidentiality is pretty important, but it's not working well sometimes because people want to talk about it. I heard he got divorced 3 times or something like that. That's not well. I was in a training session when I was young with my wife, and we got split, which means there were 2 groups and they just opened their sins to each other. But as soon as those 2 sessions ended, I just heard somebody, I know his name. He divorced 3 times. What's wrong with that? What's wrong with that? But they already made the kind of rumors and gossips. That wasn't ridiculous. I didn't like it. So when that happens a lot in the churches or Christian settings, because they got emotionally got high and they just open what they did in the past, killed some people or criminal record, misdemeanor, felony or something like that, and they open that to the group, and later on they realize that, oh my goodness, I told them something wrong. They regret a lot, but it's too late. It's too late, and almost all people know what you did in the past, and it's gonna be torturing to you, because people are gonna talk about it a lot. They're gonna talk about it a lot, alright? I guarantee that. People. Alright, so confidentiality, and this is the client, and even though our clients got deceased in the past, but we don't want to just open, talk anything about the deceased people, clients, not at all. So counselors, don't talk about your clients to anybody else, not even to your wife. I made a mistake in the past, I think 1 or 2 times, because my wife told me something about her clients and I forgot that was a secret or confidential thing, but I did talk with with my client's wife's client. That was a wrong relationship. I mean, if you are working with any clients, you don't want to you don't want to have any relationships with your clients after the counseling. You have to be, you need to know the boundaries. That's the boundary problem. Other than that, you can make the mistakes I made already. That's no good. Responding to requests and subpoenas, responding to requests, and so if there are some requirements, requests to the counselors from the counseling, and you can just respond. That's the part of the broad concept of the confidentiality. So confidentiality is quite important, so you want to just focus on it. You don't want to just ignore or neglect it. So the best thing is that you don't talk about your clients to anybody else, not even to your wife. Okay? Not even to your husband. Just finish your work in your office and forget it. Leave everything in your office, in your cabinet, and just don't bring anything to your home or somewhere else. It's so important. Informed consent to treatment. Number 1, information about the services provided. You want to just tell your counselees what kind of services you are providing. Okay. So the counselees are supposed to know what kind of services they want to get. When you just step in the subway, you know what kind of services you're going to get. Panda Express, you know what kind of services and foods you're gonna get. Okay. But the counseling centers, people don't know what's going on and what can happen, because if that is the first time for them to get the counseling services, they have no idea what kind of services they're gonna get. So they can be nervous and they have no idea what to do, because when they don't know what they are supposed to do, and they're not gonna open their hearts easily, and then it's gonna be hard for them to get started, and they are spending more time and money. That is no good idea for them, because we want to just start from the bottom, but not all the way bottom from the scratch. So we're gonna we just get started with the trust, because we know what the counselors are doing and what they are supposed. We know already about the confidentiality, but so if the counselors don't have any idea what kind of services they're gonna get, and they're gonna just be intimidated, or they're gonna learn it at the counseling sessions, and it's kind of a waste of money. And they have to pay lots of money, you know. If you want to have counseling sessions with professionals, you want to pay 200, 300. Depends on their careers and reputations and credentials, but basically they wanna pay lots of money. So pastors are free, you know. So think about it. Number 2, goals of therapy and procedures to be used. So what kind of therapies they want to get, and what kind of goals the counselors have for their counselees after the first intake. Intake means, the first basic, the most basic things in a counseling. So when you go to a counseling center for the first time, there is the first step is intake, and they collect all kinds of information from you as much as they need. And then at the first session, your counselor is trying to ask you a bunch of questions. So why you are coming, what kind of problems you have, what do you feel, and what is your hope and goal, what are you going to get from the counseling sessions, what do you expect, those kind of things. And then your counselor is going to set a goal for that, for the counseling sessions. And it is quite important, and you have to know what kind of goals they are trying to set for you, the counselees. And so you want to know what kind of therapies and what kind of goals of therapies, and what kind of procedures they want to use. For example, as counselors, I can just tell people that thank you for sharing your stories and problems and all kind of things. I think we need 5 sessions of counselings at first, and then we can just review our counselings after 5 sessions, and then we can just decide we can continue more or we can just stop there. So my goal for you is then just decrease anxiety levels, and because you have some phobias and things, and like agoraphobia or something like that, and then I want to just help you to decrease the anxiety level so you can get back to your normal life. Those things are important, okay? All right, so for that, I want to just, tell my counselors that, so for that, counseling itself is very important. And I'm going to just give you some little homeworks, so you can just try this and that for lowering your anxiety level. And then those, I want to just review what you did in the meantime for the last week, for the last 7 or 6 days or 3 days. When you have 2 sessions in a week, which is rare though. Alright? Those things are very important. If you have any inventories, you can you can know the anxiety levels, and you can say, I want to just try that inventory now, and then we're going to just do it again after the 5 sessions, and we can see what we have. Something like that. Financial issues, you have no money to pay for it, or you have insurance, you can work on it. If you don't have money, just write down, just to fill this form so we can see how we can work for it, or something like that. Alright? And then confidentiality, that's important. We already took care of it. So confidentiality and qualifications. What kind of qualifications do you have? Okay. Are you a member of AACC, APA, or you are working for the counseling center, or you are just private practitioner, or you are just you have a license in California, because we are in California right now, and what kind of credentials do you have? You can just tell your clients. Okay. What kind of qualifications do your counseling center has? Other pertinent information. So you want to just provide, the information as much as you want and your counselees need. Okay? So those things are very important, and information consent of treatment is pretty crucial. When you see your doctor is supposed to tell you how they're gonna treat your headache or lung cancer. For example, lung cancer. So you wanna just tell you are supposed to get information from your doctor. So you need X-ray at first, maybe CT, MRI, so, or tissue, bicep, okay, right, and then blood test, just measure the height and weight, simple. Blood pressures, and you are supposed to visit the hospital, doctor's office once a month or twice a month. Okay, and you need to watch your diet, the sleeping habits. Just sleep like 7 hours a day at least. Those things. Take some medicines. They tell you just almost everything that you are supposed to know. Because doctors are working on you, and you have to working on your stomach cancer also by yourself. You have to work on it, right? So, and you are working with your doctor. And counseling is about the same. Counselors want to tell you, what kind of things they want to try, and you have to work on your mental health, like stress, example, or anxiety. You can trust your doctor, your counselor is working on your anxiety, but they want you to work on, they want you to work on yourself. So you just have, good food, good sleeps, just special trainings or homeworks or stretchings or workout or just, many other things, calling your doctor once in a while. Those things are very important. So informed consent for treatment. And lastly, documentation. Protected health information, PHI, basic information. Alright, so documentation is important. All things are supposed to be documented. I like the documents. If you don't see any documents, and you get in trouble, and your organization, yourself, and all things can get distorted, I'm kind of, person who, procrastinate and kind of lazy sometimes in a certain areas especially. And those things are kind of pulling my legs. But the documentation is important for the organizations, for the councils. You collect all kinds of documents, bills or something like that, paperless or whether that is paperless or paper, and you have all kinds of documents. Documents for the payment, all right, that's important. Those are why we document. Why we need documents for our counselors or something? Because we want to take responsibilities. Because we want things be, keep those things safe. So we want to just keep the documents. Documentation, it's ethics. If we don't have any documents, we just, make a contracts, sign on. We don't sign on any documents or consent forms. But we just talk with verbally, about the counseling or something. You just pay $30 or $50, $300, just be careful. I'm not going to tell about you to people. Those are all verbal. No, I don't trust it because we are more ethical. We keep our laws when we sign on the documents. Both sides. All parties. So we are making documents to be more ethical. That's a big part of ethics. Okay, payment, receipts, date of the session and the session stop time. Or counselors come late. You can come late, but you have a limited time. We have 60 minutes counseling, but you are 10 minutes late, so I can give you 15 minutes counseling. You late, you lose your time. No makeups. It's about the money. So there was a session, and session stop time. It's in the consent form and documents. So you want to keep the time, so you respect your counselor's time, you respect your counselee's time. Modalities and frequencies of treatment furnished, okay? How many times? Medications. So for the prescription, you need to prescribe prescription. Okay, those are all have to be documented. So your family doctor can know what's happening to you. So they have to know what kind of medicines you are taking, so they can avoid any conflicts, any problems, because all medicines are chemical things. So when they just got together, they make something wrong. What if your on medications from your counselor and medication from your family doctor consumed together, and they produce any toxic in your body, and you're gonna die. You're gonna sick, die. You have more problems. You don't want that, right? So medications documented. Results of assessment or testing. Okay. So there can be some assessments, for example, anxiety levels, depression levels, some questionnaires, inventories, professional, okay, scientific or treatment, testings, lots of testings, physical, emotional. Whenever you move to, whenever you have new doctors, you just tell your doctors, your history of sickness, disease, operations, surgeries, and medicines. You want to tell everything to your new doctor, so your new doctor can understand, what's happening, what happened, and what's happening, and what will happen to you. And they're gonna be careful not to mix particular medicines and treatments or something like that. When you are under anxieties and it's going to be very difficult for you, not all of you, but at least some of you have, when you have MRIs or CTs, because you are supposed to be kind of freeze on the bed, narrow bed, and you're gonna get in the, kind of cavity thingy, and you will hear lots of noise there, and that's gonna be very hard for you when you have anxiety problems, particular anxiety problems. So those are things that are very important. So just you have to let all doctors know everything about you, mentally, physically, emotionally. If you want to see and have a counseling with your pastor, you want to just tell your pastor about your the spirituality too. But anyways, those things are very important. Okay. Summary of symptoms. What kind of symptoms you have? You have sweats, you have fever, or your body is shaking. Functional status, process to date, diagnosis, treatment plan, prognosis. Those are things that need to be documented, right? So can you imagine how many patients and counselors your doctors and counselors have? Because they want to just remind what's going on to you, so they just read the chart. Some people have big chart, so they just review that chart in front of the patient's room or counseling room, and they just read it quickly as much as they can, and they understand it, and they mind what happened to the particular patient, and they just work on it. And they can come in and talk to you with all kinds of reminders, because they cannot remember everything. They cannot memorize everything. So they just refresh their memories and remind particular things for you. So for that, documents are so important. So diagnosis, treatment plan, all kinds of prognosis, those are in the documents, and then you'll be safe, and they'll be safe, and then it's going to be easier for both parties. It's eventually for the counselors. You don't get benefits from counseling because you are paying for it and spending your time for that. Alright, so those things are very important. I think this is it for today, and when we get back to the next session, which means next Monday, we want to just talk face to face in class, and it's gonna be better. And whenever I just can just tell you only in front of the camera, it's kind of boring and exhausting. But anyways, I'm just looking forward to see you next Monday, and we will continue the Lordland ethics in counselings. All right, that's it. Thank you.